The Uganda National Immunization Technical Advisory Group, a CASA group of consultants, and Medics for Faith Association interacted with Parliament's Health Committee, which is scrutinizing the Public Health Amendment Bill of 2021. The Immunization Advisory Group advised that mandatory vaccination should be for regular vaccines.
For vaccines under emergency use, there should be informed consent. Also, people should be educated as much as possible. Mr. Chairman, there are vaccines for COVID, they are under emergency use. Even the recent polio vaccine is also under emergency use. And indeed, it came to our committee, and we approved its use for a certain period of time, but not to be listed yet until we know it is completely safe.
Vote on this bill with evidence. The evidence coming from science, from research. So I'd like to pray that as we deliberate on this bill, let emotions not override our cognitive capability.
Medics for Faith Association, who are against mandatory vaccination, say that emergency use vaccines sometimes come with challenges because many are under trial.
We recommend that the approach not be mass vaccination, but rather seek to identify target populations that are most at risk and will benefit maximally from the strategies that are being proposed.
Especially the mRNA vaccines that are coming out. The biggest challenge that we have is that these are gene therapy based vaccines. And because their long-term outcome is not known at this point in time, there is a sensitivity when it's applied to both adults but children as well.
You are not fair. Even routine immunization against the TB, against the measles, a child can die. So are you saying we stop?
The consultants from ECASA think that those who do not want or fail to be vaccinated should not be heavily punished.
Our proposal is that we should consider lighter penalties, such as community services, confinement within their defaulters' premises.
One does not consent to receiving an emergency use vaccine. They should not be punished for their decision.
The Immunization Advisory Group says the bill should look at penalizing people who engage in deliberate spread of misinformation about vaccines and immunization. The committee were given 45 days to process the amendment bill, which will repeal obsolete provisions. Juma Kiria, NTV.